Welcome, everyone. Today we are going to understand H1 antihistamine drugs, also called H1 antagonists, using this visual mnemonic scene. Instead of memorizing long pharmacology lists, we will decode the image like a story. Every object in this picture represents a high-yield exam concept. Let's explore the scene. Imagine a battlefield where a powerful hero called H1 Man stands ready to defend the body. This warrior represents the H1 antihistamine drugs. On his shield, you can see the words H1 block. This tells us the main mechanism of action of these drugs. H1 antihistamines competitively block histamine H1 receptors. By blocking these receptors, they reduce allergic symptoms such as itching, sneezing, rhinorrhea, and swelling. Now look at the creatures flying toward the hero. They are labeled pollen monsters. These represent allergens that trigger histamine release, such as pollen. When allergens stimulate mast cells, histamine is released and produces allergic symptoms. But H1 Man blocks histamine, protecting the body from these allergic reactions. Next, let's look at the left side of the image. Here we see a man labeled Sleepy Ben. He is yawning and looks extremely drowsy. This represents first-generation H1 antihistamines, such as diphenhydramine. The key feature of these drugs is sedation. Why do they cause sedation? Because they are lipophilic, meaning they can cross the blood-brain barrier easily. Once inside the brain, they block central histamine receptors and produce drowsiness. So the sleepy character reminds us, first-generation antihistamines cause strong sedation. Notice the sign near Sleepy Ben. It reads BBB crosser. This represents the blood-brain barrier. First-generation antihistamines can easily cross this barrier. This is why they produce central nervous system effects, including drowsiness. So remember, first-generation antihistamines lead to cross the BBB, lead to cause sedation. Now let's move to another important part of the scene. Near the center of the image, you can see a dry desert plant labeled dry mouth flora. This represents anticholinergic side effects. First-generation antihistamines not only block histamine receptors, but they also have anticholinergic activity. Because of this, they can produce side effects such as dry mouth, constipation, blurred vision, urinary retention. The dry desert plant is a visual cue reminding us of dryness caused by anticholinergic effects. Now, look at the right side of the image. Here we see a character called Alert Lore climbing a wall. Unlike Sleepy Ben, he looks awake and energetic. This character represents second-generation antihistamines, such as loratadine. The key feature of these drugs is that they are non-sedating. Why? Because they are more hydrophilic, which means they do not cross the blood-brain barrier easily. So they mainly act in the peripheral tissues without causing significant drowsiness. That is why Alert Lore looks awake and alert. Notice the wall labeled BBB limit. This wall represents the blood-brain barrier, preventing entry into the brain. Second-generation antihistamines do not cross this barrier significantly, so they produce minimal sedation. This is why drugs like loratadine, cetirizine, and fexofenadine are preferred in many patients. Now, look near the bottom right corner of the image. You can see sparking electrical wires labeled QT circuit spark. This represents an important cardiac side effect. Some antihistamines can cause QT interval prolongation, which may increase the risk of dangerous arrhythmias. Although this is uncommon with modern antihistamines, it is still a high-yield pharmacology exam point. So the electrical spark reminds us of QT prolongation on ECG. Let's now summarize the entire mnemonic scene. The H1 Man hero with the H1 block shield represents H1 antihistamines blocking histamine receptors. The pollen monsters represent allergens triggering histamine release. Sleepy Ben represents first-generation antihistamines, which cause sedation because they cross the blood-brain barrier. The BBB crosser sign reminds us of their lipophilic nature and CNS effects. The dry desert plant represents anticholinergic side effects, including dry mouth and constipation. On the other side, Alert Lore represents second-generation antihistamines, which are non-sedating. The BBB wall reminds us that these drugs do not significantly cross the blood-brain barrier. And finally, the QT circuit spark reminds us of the potential risk of QT interval prolongation. So the next time you think about H1 antihistamines, imagine this entire scene. the heroic H1 man blocking pollen monsters, the sleepy first-generation drugs crossing the brain barrier, the dry anticholinergic desert, and the alert second-generation drugs staying outside the brain. By recalling this single visual story, you can quickly reconstruct the entire pharmacology of H1 antihistamines.